It is my pleasure to invite the first speaker of this morning session to open the papers of the Congress. And this is Mrs. Olga Pechanova. She's the president of the International Society of Pathophysiology. It's a great honor to have you among us, and the floor is yours.
Ladies and gentlemen, dear colleagues and friends, first of all, I would like to thank once again, namely to Professor Ovidiu Kotoi, to inviting me to your national conference. I appreciate it really very much, and it's my great pleasure to spend with you the next 2 days in your conference. And I would like also to convey many greetings from Slovakia, from Slovak colleagues from Bratislava, and also from International Pathophysiological Society. As you know, the main task of International Pathophysiological Society is to bring together people from different nations, but also bring together clinicians and scientists. And you've done this task really excellently. I also have the possibility to listen the presentation of your young colleagues yesterday, and they were also excellent. So I know that pathophysiology in Romania is really in good hands. So I'm sure that you are quite familiar with the topic of metabolic syndrome, which is the cluster of hypertension, increased level of triglyceride, obesity, of course increased level of glucose, and on the other hand decrease the level of HDL cholesterol. And recently there is always adding some new factors of metabolic syndrome, like increased level of leptin or increased level of oxidative load. Concerning oxidative load, the free fatty acid during the increased cholesterol level or obesity may activate ceramides, which further activate different enzymes which produce reactive oxygen species like NADPH oxidase, producing superoxide, and then reactive oxygen species further activate also nuclear factor kappa B, the subunits of nuclear factor kappa B, and which penetrate to the nuclei, and further may increase the production on some inflammatory gene like inducible nitric oxide synthase. Also, ceramides may further inhibit ACT activity with decreased phosphorylation of endothelial nitric oxide synthase and decreased production of the good endothelial nitric oxide. So in our experimental studies, because I am a researcher, not clinician, we would like to determine this pathway of reactive oxygen species and also of nitric oxide in experimental metabolic syndrome. Because I know that many of you are clinicians, so you know that the best and probably the first drug in treatment high cholesterol and obesity are statins. And also in our experimental studies, we were able to see that really if we treat the animals with arginine, which is the substrate for nitric oxide synthase, or spironolactone, or simvastatin, you can see there that really we have seen the increase of expression of endothelial nitric oxide synthase after treatment with spironolactone and simvastatin. However, concerning the relaxation responses of those animals, we were able to see the improvement of relaxation responses just after the treatment with simvastatin. So also in our other studies, we would like to use statins. However, I don't know how it is in Romania, but Slovak clinicians have a quite different opinion on treatment with statins, because they have also too much side effects. Among them, a very general is, for example, headache, difficulty sleeping, flushing of the skin, nausea and vomiting. However, what is the most important it is muscle aches, tenderness or weakness, and even myalgia or myositis. So these side effects are really very serious, and some clinicians are quite worried about this. But still, statins are the first drug in the treatment of increased cholesterol level. So as the scientist, what we can do with this? On the one hand, it's the good drug for decreasing obesity and cholesterol. Other hand, many side effects and very serious. So we have at least two possibilities. At first, we can improve the old drug, for example, by loading it to some nanoparticles to ensure more targeted therapy with the aim to decrease the dose of the treatment and also along with decrease of side effect. And we have also another possibility to develop new drugs, and many of them have some natural basis like polyphenols. So, concerning the first aim, together with our colleagues from the Institute of Physics in Slovak Academy of Sciences, we prepared the nanoparticles from polyethylene glycol monoacrylate, which were tame and temperature stable, degradable by hydrolysis, and the size, as you can see, is 250 nanometers. It's not very small, but still nanoparticles. You can see the size distribution here. It's really about 250 nanometers. And we tested also the accumulation of these nanoparticles by marking them by coumarin and looking for accumulation in liver and in spleen. This is the spleen with the nanoparticles in the reticuloendothelial system, and it is marked by green, as you can see, and they were accumulated quite well. And now the results. Of course, we have several groups to compare the powdered normal simvastatin and the nanoparticle loaded simvastatin. So we treat the animals, obese, zucker rat, with powdered simvastatin, and also with coenzyme Q. Coenzyme Q, I think that you know why. Because one of the side effects of simvastatin and all statins is decreasing coenzyme Q, and that is the cause why the ATP is decreased and why the patient have this movement disorders. So we have another group with coenzyme Q, and the last one was together, simvastatin and coenzyme Q. It was powdered, and the next part of the animals receive nanoparticle loaded similar drugs in similar dose. And these are our results. You can see that concerning powdered drugs, we were not able to see any effects concerning simvastatin, coenzyme Q, or the combination treatment. This is the level of total cholesterol of obese zucker-fed rats, and you can see that simvastatin, coenzyme Q, and the combination did nothing with this. And the same was true for triglycerides, also for HDL. You can see that HDL, it was funny, was increased in these obese rats. Probably it is something like compensation effect, and the same is true for HDL. And now this is the part of the animals which receive the nanoparticle loaded simvastatin. You can see there that concerning total cholesterol, even we see we were able to saw some trend of decreasing. It was not significant. However, it was significant concerning triglycerides and also concerning LDL. So nanoparticle-loaded simvastatin was able to decrease the concentration of triglyceride in the plasma and also LDL, not coenzyme Q. As I said, we would like to see what this drug happened with reactive oxygen species, with lipid peroxidation, and also with the nitric oxide pathway. And you can see here that concerning the expression of NADPH oxidase subunit P22, concerning powdered simvastatin, we see no effect, but concerning nanoparticle-loaded simvastatin, this was able to decrease NADPH oxidase expression almost to the control level of lean rats. However, coenzyme Q hadn't this effect because of decreasing reactive oxygen species, and this is the product of NADPH oxidase. So it's quite normal that coenzyme Q didn't decrease the expression of NADPH oxidase. And what about the lipid peroxidation? We use as the marker conjugated dienes. There we were able to see that combination of simvastatin and coenzyme Q, even powdered, decrease the lipid peroxidation. However, concerning nanoparticle-loaded drugs, all of them decrease the lipid peroxidation, as you can see there. What about nitric oxide synthase, a nitric oxide pathway? We look in the heart and in the aorta, and yes, again, no effect concerning powdered simvastatin or coenzyme Q. However, in the aorta, we were able to see the increased nitric oxide synthase activity using combination of simvastatin and coenzyme Q. However, concerning the expression of endothelial nitric oxide synthase, simvastatin, nanoparticle-loaded simvastatin, increase the level of expression. You can see here and here, coenzyme Q hadn't this effect. And actually, this trend was visible also in the heart. What about nanoparticle-loaded drugs? You can see that in nitric oxide synthase activity, the combination was able to increase the activity also in the heart. In the aorta, it was just the coenzyme Q alone also. And concerning expression of endothelial nitric oxide synthase, we saw the same trend. Simvastatin in both those were able to increase this expression, but in the aorta, this increase was significant. What about the blood pressure? Obese rat haven't hypertension, so this is the normal blood pressure. Even this is quite higher. However, this effect, which we were able to see in nitric oxide synthase and also in reactive oxygen species, hadn't the effect on the blood pressure, probably because these rats are not really hypertensive. And the second task, to try to find or to develop some new drugs. This is the first step to see how can do and to see on the effects of some natural products, for example, polyphenolic compounds. And we would like to see the effects on the similar parameters of the concentrate or extract from Slovak Alibernet red wine, which we characterize, and the content you can see here. It has the catechin, epicatechins, quercetin, caffeine acid, gallic acid, and so, and also some very good minerals. We prepare from this wine non-alcoholic 10 times concentrated extract and also treat the animals. In this experiment, it was hypertensive obese animals, and you can see that this concentrate, we name it Slovinol, was able to decrease glucose and also triglycerides. And you can see again that as compensatory mechanism in these animals, the endothelial nitric oxide synthase is increased in the aorta, and this extract had no effect on endothelial nitric oxide synthase expression. However, it decreased inducible this inflammatory nitric oxide synthase isoform. And the same was true for nuclear factor kappa B, which is also a pro-inflammatory factor. You can see it also in immunohistochemic graph and picture. So you can see there nuclear factor kappa B in the aorta and left ventricle in these different groups, and inducible nitric oxide synthase in the same groups. And you can see that really our concentrate decrease nuclear factor kappa B and eNOS comparing the obese hypertensive rats. So I would like to conclude my presentation with some home take messages. First of all, nanoparticle-loaded statins appear to be promising drugs for illness and mortality, for reduction obesity, cholesterol in patients who are at high risk of cardiovascular diseases. And the second, probably natural polyphenols appear to be promising alternative therapy in patients with statin intolerance. I would like also to you for your attention, to my colleagues for helping with this study. And finally, please, this is the internet address of International Pathophysiological Society, and you can find there many news, so please come and see. And thank you once again.